Hi, everyone. I'm Dr. Fran Rowe, one of the veterinary nutritionists here at Mad Barn, and welcome back to Mad Barn Academy. And if you're new here, welcome. We hope to earn your subscription today. It's foaling season. Some of you may already have foals on the ground, while others of you are still waiting for your mare to foal. But I thought it would be a great time to review the post-foaling benchmarks every owner should know for foaling, as well as discuss some of the other things to watch for during that time between birth and the first vet visit. So let's get started. In the immediate post-foaling period, there are certain benchmarks both mom and baby should meet within a particular time frame. This is known as the 1-2-3 or the 1-2-3-4 rule, depending on who you talk to and how many time points you follow. But following these time points can help owners feel confident that things are progressing normally, or maybe that they're not progressing normally. Identifying issues promptly is really important, and the 1-2-3-4 rule is meant to provide owners with a guideline to follow during this time. So let's go through each of these 4 time points in more detail. Number 1 is foals should be standing within 1 hour of birth, and specifically standing independently by 1 hour. So certainly providing some initial assistance is okay, but they should be able to get up and stay up on their own within that first 1 hour after being born. A foal that is not able to stand unassisted within this time frame would be considered abnormal. 2 is foals should be suckling within 2 hours of birth, and specifically, they should be able to latch, remain latched, and suckle independently by this 2-hour point. Again, providing some initial assistance to locate the udder and latch onto the teat is okay, but a normal foal should have a strong drive to seek out the udder and will have a strong and really ferocious suckle if you offer them a finger to suckle on. It's really important that foals be up and nursing quickly after birth because they have minimal body reserves, especially compared to adult horses. So they're at a real risk for dehydration and low blood sugar, which can really snowball out of control quickly if they are not able to nurse and receive energy and calories from that colostrum and from that milk. Additionally, it's critical to ensure that the foal receives adequate colostrum intake within the first 12 hours of life. Foals that are slow to stand or slow to suckle are at risk for health issues, including failure of passive transfer of immunity. Number 3 is that the mare should pass her placenta around 3 hours postpartum. Many mares will pass their placenta around the time the foal begins suckling because that oxytocin boost that results in milk letdown in the udder also causes some uterine contractions that assist in the final expulsion of those fetal membranes. It is really important that owners do not pull on the fetal membranes to remove them. You risk tearing them and leaving some behind within the uterus. If the fetal membranes are dragging the ground, getting trampled in the way of the foal, you can simply tie them up above the level of the hocks with a piece of baling twine. And once that placenta has passed, it's really important to save it either in a trash bag or in a muck bucket away from wildlife or the barn dogs for your vet to examine at the post-foaling exam. It's really critical to ensure that the entire placenta has passed. So your vet is going to want to lay out that full placenta and ensure that all of the pieces are accounted for. Fetal membranes retained beyond 4 to 6 hours are considered a medical emergency for the mare. Our last time point, number 4, is that the foal should pass its meconium, or that first manure, around 4 hours of age. So those of you who have experience with foaling know that meconium isn't quite like normal manure, but rather it's really sticky and kind of dark in color. You may not be able to see it in the stall Once that foal defecates, it's easily lost in the stall, but you can check kind of under the tail to see if there's any evidence of meconium kind of smeared under the tail or on the rump. It's really important that foals pass their meconium. Those that don't are at risk for meconium impaction, which is the most common type of colic in young foals. Foals that are straining to defecate should be administered an enema. Many vets and owners use a basic sodium phosphate enema like the Fleet brand that you can buy at the drugstore. Alternatively, a soapy water or warm lube enema can be given using a leftover enema bottle or a red rubber catheter. If you do use a phosphate enema like Fleet brand, it's important not to give them repeatedly. If you have used one to help your foal pass its meconium, be sure to tell your vet so that they can use a different option like soapy water if that foal needs continued assistance. Additionally, around this time, you can dip the foal's umbilicus with an antiseptic solution like dilute chlorhexidine or dilute betadine. This is just to keep that umbilicus, which is essentially an open wound, clean and helps it dry out to prevent infection. In addition to the 1, 2, 3, 4 benchmarks that we're going to be looking for during this time period, there are some other important observations that you can make during that first 12 to 24 hours of life to make sure that the foal is getting off on the right foot and healthy. So healthy, normal foals are going to be energetic and really curious about their new environment. Sure, they're going to be laying down and sleeping often, but they're going to be up equally as often to suckle, and it's normal for them to be up and nursing about 4 to 6 times per hour. So, really looking at that foal's attitude and energy level to determine if something isn't quite right. Is that foal a little bit lethargic, a little bit dull? Additionally, take note of a few other things like time to first urination and if any urine is dripping from that belly button. Most foals will urinate within the first 9 to 10 hours of birth, so it's important to keep a lookout for that milestone. You can also make note of any, flexural deformities like tendon contracture or tendon laxity, both of which are fairly common in newborn foals. The latter wouldn't necessarily warrant an emergency visit so long as that foal is able to stand and meet their other benchmarks, but you can discuss any of these observations with your vet at the time of the post-foaling exam, and certainly your vet's probably going to ask you about these things too. Okay, we're going to wrap up today talking about when it's time to call the vet for a visit. So fortunately, a vast majority of foalings are normal and both mom and baby meet their benchmarks as expected. In these cases, a wellness exam should be performed by your vet the following day when the foal is 12 to 24 hours old. Most mares foal in the middle of the night, so you'll be looking to call your vet's office first thing the next morning to get on their schedule for a checkup. At this visit, your vet's going to perform a full physical exam on mom and baby and ask about these benchmarks, so be ready to provide this information. Your vet will also recommend pulling blood to test the foal's IgG level to ensure that they consumed enough colostrum. So, what if things aren't going right during these first critical hours of life? What if you have concerns or questions about something that's going on? Call your vet for assistance. Prompt intervention can be the difference between life and death for both mom and baby, and it's never wrong to call your vet with questions or concerns. Some examples of scenarios that constitute an emergency vet visit before that 24-hour time would include a foal that is unable to stand or suckle, i.e., failure to meet benchmarks 1 and 2, a foal that appears weak, lethargic, or has otherwise abnormal behavior, a foal that continues to strain to defecate despite having received an enema, so failure to meet benchmark 4, a mare that does not pass her placenta, so failure to meet benchmark 3, and certainly a mare that is acting colicky, uncomfortable, or is showing aggression towards that foal and not allowing the foal to nurse. Okay, so here are references for today. And I thank you so much for listening. I hope that today's video makes you feel more prepared for welcoming that new foal into the world, hopefully very soon. Don't forget to like and subscribe and explore the other videos on our channel. I've also included the links to several resources in the description of this video below, so be sure to check those out if you want to learn more about foaling, colostrum, and managing mares during lactation. Okay, thanks again. Until next time.